So, Dr. Henley, thank you again for sharing some time with us today, having some
My
questions
pleasure.
answered. I'm sure everybody out there who's doing their research on whatever procedure they're looking for will find a lot of your insights valuable. So, with that said, what is the most popular procedure you see these days?
That's a difficult question because people come in with variety of needs, and also we have number of injectable fillers, Botox, Radice, Restylane, Perlane, Hyalin. All these are substances that are minimally invasive, and we can do these in the office. But I also see a greater demand for people who want to see a more defining change, a change in structure. I see people who have thin lips, want fuller lips, who have large noses, want smaller noses, who have small noses, want larger noses. And those are considered structural. And another common procedure is the aging process that creates both sagging of tissues and changes that people don't like. The nasolabial folds, the low jowling, the hoods over the eyes, and I'm the prime example of the aging change. There are things that begin to hang.
So, with that said, I mean, the fillers are quite popular. What are some common mistakes that women tend to make when it comes to Botox and fillers?
I think the common mistake is when people try to design their own treatment. They go on internet, they read that advertising about Restylane or Botox, and they come in, I want this new stuff, or I want this new brand. Ideally, they should see their physician who is skilled in blending all these technologies and customizing it for the maximum benefit of the patient. Some patients may need a little filler, but they may need a little laser work for texture on the skin. Some people may need structural work. Some people may need a combination of all these technologies. And I think the problem that happens when we have this flood of information and flood of marketing, that you're taking and you're commercializing basically what is an artistic endeavor that uses technology.
Interesting. So, one of the things, speaking of the media and things that people may see and come across, is the idea of using Botox in place of a nose job or a rhinoplasty.
Or a filler in place of a rhinoplasty. And there are practitioners who, if there's a bump on the nose, by injecting a filler on both ends of the bump, you can kind of create a smoothness. So it's a useful temporary tool, but it does not really change the anatomy.
So it's almost like a training wheels nose job to get you used to what you might look like before you actually do one.
It's being advertised as a non-surgical rhinoplasty. And yes, aesthetic procedures are becoming popular. There are a lot of practitioners from different training that are coming into play. And I have to quote another senior member of our academy as he's reflecting on the time we live in. He says, well, I'm seeing a lot of surgeons becoming non-surgeons and a lot of non-surgeons becoming surgeons.
Well, that also speaks to a lot of like the med-spa practices that you see now. People kind of like OB-GYNs even doing Botox. Like, it's very weird.
Well, I'm not going to pass any judgment on it, but yes, there are many practitioners who have not had the aesthetic surgical avocation for most of their lives. And they acquired it recently, and because we have an injectable, and they think they can make a lip larger with a single injection. And some practitioners are good at it, and some are questionable. What I want to emphasize is that if you want to look better, there are certain age-appropriate technologies that, when used in combination, can really make you look good.
So
it's not one thing or the other thing, but it's a combination Sometimes there's laser work, injectable, or surgery, or a combination of all those things.
And that can span someone from 25 and up. I mean, you could find somebody who needs acne to be dealt with on the surface. They
Right.
might have issues with the way their nose shape is, and they could only be, 27 years
Right.
old, and there are things that you can do.
Right, and sometimes there's a problem with the nose that when it's corrected, then your critical eye goes on the residual acne. Sometimes it makes more sense if I have the patient asleep to correct both. Sometimes the patient has a breathing problem and a sinus problem, and they may have a bump or a distortion they never like. That's an opportune time, because it's one recovery, correct both.
So now your expertise is also in otolaryngology?
Yes, I'm board certified in otolaryngology, ear, nose, and throat, and I'm also board certified in cosmetic surgery. So I have been practicing facial plastic surgery now for 25 years, and I've accumulated quite a bit of experience both with judgment and variety of technologies, including of lasers, fillers, injectables, surgicals, and now most recently the BioMatrix Lift, which is really the closest we come to tissue regeneration and repositioning.
That is excellent. I find you incredibly knowledgeable, and you can cut my face open anytime. Thank you, Dr. Henley.